In this video, we will try to understand the cardiac cycle in correlation to the normal heart sounds, and we'll try to correlate the murmurs we listen over the heart to the cardiac cycle for better understanding. So if we start from the end of diastole, so at the end of diastole, the ventricles are filled with blood, and now it is the time for closure of the mitral and tricuspid valves. No need for the mitral and tricuspid to stay open. So here we will put this first mark, which marks the closure of mitral and tricuspid. After closure of the mitral and tricuspid valves, the ventricle starts to contract, so the pressure will increase inside the ventricle. Early at this stage, the ventricle contracts, but with all valves are closed. Why all valves are closed? Because during diastole, the aorta and pulmonary, aortic valve and pulmonary valves were closed, because the only open valves during diastole were the mitral and tricuspid for ventricular filling from the atria. And now mitral and tricuspid are closed, and also still the aorta and pulmonary are closed. So when the ventricle starts to contract, here all valves are closed, and we call this isometric contraction phase, which is contraction without a change in the volume inside the heart. And then the aorta and the pulmonary at this step opens, and then blood goes into the aorta and the pulmonary in rapid ejection, and then reduced ejection phase, and then protodiastole. So during this phase, the heart evacuates its content. So it is systole. And it is marked by the closure of mitral and tricuspid valves. So closure of mitral and tricuspid causes first heart sound, and all the events after first heart sounds are systolic. So if we listen to any murmur, which is, murmur is turbulent blood flow, audible turbulent blood flow. So if we listen to the murmur after the first heart sound, so it is systolic. Now the ventricles have evacuated all its content, and it needs to fill again. So it needs to go into the diastole. So the start of the diastole is marked by closure of the aorta and pulmonary, because now no need for them to be open. We are not evacuating the content of the heart, of blood into the circulation. And the closure of the aorta and pulmonary marks S2. From this, we understand that closure of the valves cause the heart sounds, but opening of the valves doesn't cause any heart sounds. So closure of mitral and tricuspid S1, aorta and pulmonary S2. After that, the heart muscle relaxes, and it goes into a similar stage like what was in the isometric contraction, but this is called isometric relaxation, because the ventricle relaxes, but still all the valves are closed. Why? Because now aorta and pulmonary are closed, and during systole, the mitral and tricuspid are closed. This will create a negative pressure to suck blood when the mitral and aorta opens, mitral and tricuspid opens. At this point, mitral and tricuspid opens, and then the filling starts with rapid filling and then reduced filling. Usually 70% of blood goes from the atria to the ventricles by gravity without any contraction, but there is atrial contraction at the end of diastole. We call it late diastole, and this actually atrial systole is important, because if we have narrowing in the valves in front like mitral stenosis, so this will accentuate the turbulence of blood flow, because this will increase the passage of blood through the stenosed valve, which what we call pre-systolic accentuation. And at the end of diastole, mitral and tricuspid close again to mark the first heart sound, and this is the cardiac cycle. So mitral and tricuspid are closed and at the start of systole. So if the mitral and tricuspid remain open because of regurg, this will lead to systolic murmur. So if we draw this like this, or I think it is better to have it straightforward, so we can get it like this. So if we have this line, and then let us put the heart sound. So here is the first heart sound, S1, and here is the second heart sound, S2. All events here will be systolic, and all events here will be diastolic. Of course, until the other S1 of the next cycle. Okay. So if the mitral and tricuspid remain open, this will lead to passage of blood from the ventricle to the atria during systole, which is not the aim. The aim during systole is to push blood into aorta and pulmonary. So regurg of blood into them will happen, and this will lead to pansystolic murmur. Pansystolic murmur in case of mitral regurg or mitral regurg or tricuspid regurg. Okay. And we mentioned that here the aorta and pulmonary opens. So if we have aortic stenosis or pulmonary stenosis, so this will lead to murmur here, which we call ejection systolic murmur of aortic stenosis or pulmonary stenosis. Aorta and pulmonary here at the start of diastole should be closed, but if they have any incompetence, blood will return back, causing what we call early diastolic murmur of aortic regurg and pulmonary regurg. During the diastole, filling of the ventricle happens and the blood passes from the atria to the ventricles. So if during the passage of blood here, there is narrowing of the valves, like mitral stenosis or tricuspid stenosis, so this will lead to mid-diastolic murmur after opening of the valves after the isometric relaxation phase. So it's called mid-diastolic rumbling murmur with pre-systolic accentuation, because when the atrium contract against the narrow valve, this will lead to this issue. So here, mid-diastolic with pre-systolic accentuation in mitral stenosis and tricuspid stenosis. Okay, we can have both systolic and diastolic murmur over the whole cycle, which we call machinery murmur, in case of PDA, patent ductus arteriosus, because if there is connection between the aorta and pulmonary, and you know the pressure in aorta is higher than the pulmonary in both systole and diastole, so blood will continue passing between both. I hope this is helpful to understand the murmurs in correlation to the cardiac cycle.